these kits. And I just happen to have one here. And they're like pregnancy test kits. You put a bit of blood rather than urine in the hole, put a little bit of solution in, and then you can see bands appear. The announcement today from Public Health England is that they've done a contract with Roche, the Swiss drug company, who have a big diagnostic division, to make kits that they claim are 100% accurate. The real difficulty, we screened the stuff, it was actually 4 weeks ago we did that, and around 10% had antibodies. So some had been infected, clearly. We're doing it again this week to see if more have been infected over the last 4 weeks. What governments hope, and what employers hope, and what, of course, international travel agencies hope, is that somehow you could have this test here and you could wear it as a badge on a necklace and get through passport control to show you're immune. But if only 10% are positive, it's not going to work. It's just not going to be feasible. There have been studies all around the world so far. We're new to the game in this country. Other countries have done it much earlier, 3 months ago. And in Korea and Singapore, it was about 15%. In America, in California, in the Bay Area around San Francisco, a large population government study showed only 1.5% had antibodies. So as the pandemic goes through, more and more people get it, more and more people develop the antibodies. And so the percentage you'd think would go up. And that's why we're doing our staff again. It's a simple finger prick blood and put it onto this little bit of plastic and wait 15 minutes. We'll get a lot of information for it. I don't think individuals, there's no point them rushing out to buy these tests. There have been fairly unscrupulous people, especially in allowing people to mail order these kits. There are some services offered in London that are charging £390. So, and that it adds a little bit of, smartphone doctor advice and that sort of thing. But in reality, to an individual, I would say there's no point having it. It's not telling you anything you don't know. It's much more useful from a public health viewpoint than from an individual viewpoint. And that's how I think it's going to be used. But it will be a useful addition. I think it's the two tests together, the test for the virus and then the test for the antibody. And that provides an awful lot of information that helps us put the jigsaw puzzle together.